We start. Hello, everyone. We are starting, or should I proceed? خلاص نبتدي؟ ايه خلاص. Hello. It is Sickle Cell Disease International Day, and for this occasion, I'll present some information about sickle cell disease. My name is Adil Al Khatti. I'm a hematologist and medical oncologist at Johns Hopkins Aramco Healthcare. This is an outline of my talk. I'll start with telling what's sickle cell disease. It has other names and some variants collectively included in this disease. Then we'll go on how one gets sickle cell disease, which population are more likely to be affected by sickle cell disease, what are the manifestations of sickle cell disease, how we treat sickle cell disease, and how to prevent sickle cell disease, and at the end, a few points of summary and conclusions. Sickle cell disease is a group of inherited autosomal recessive diseases. Autosomal recessive mean that if you have only one gene or the genetic code abnormal, you don't get it. You just carry the trait. To get the disease, you have to have both genes that control the production of hemoglobin affected. So one is born with it, since it is passed from the parents. It stays with the affected person all through their lives. And as I said, you have to have two hemoglobin genes must be affected, one from each parent, one from mom, one from dad. So the possible combination that lead to this disease is one gene is hemoglobin S, which is the abnormal hemoglobin gene. And the other one is also S in most cases, but it could be other genes such as non-functional gene, which does not contribute to the production or minimally contributing to the production of hemoglobin gene. It can also be another abnormal hemoglobin, and there are many of them, hemoglobin Punjab hemoglobin or Arab hemoglobin E, and so on. So in summary, both parents must have at least one gene affected with sickle cell to the children to be affected by it. So it's passed from parents to their offspring, to their children. And this is just a schema of how it is passed. In this case, both parents have what we call sickle cell trait, which means only one gene is affected. So these are the probability. In this case, the children have each, of course, pregnancy is independent of the other. So during each pregnancy, the likelihood or the probability of having a normal person or a child born is 25% of the time. Half of the time it will be carrying like his or her dad's. And in quarter of the times, 25%, the child will be affected by sickle cell disease. When do you find sickle cell disease? This is a map of the old world, little bit of Europe and Asia and Africa. This is not very complete one, but it shows you where it's most prevalent. And if you know the geography, this is Saudi Arabia. So the eastern part of Saudi Arabia has lots of sickle cell disease. So is the northwest, and also missing here is the southwest. Also India, in some parts of it, they have it, and many other places. In Africa, it's very prevalent, especially West and Central Africa. So it's distributed in many areas of the world. What's the distribution of sickle cell disease in Saudi Arabia? One of the first description, not the first, in fact, the first description of the presence of sickle cell disease was recognized in the 50s of last century, when Dr. Lehman came and collaborated with the doctors in Aramco at that time. The Haran Health Center is the same one, still existing, and tested about 1376 Aramco employees between 1955 and 1957. And the Aramco employee at that time were also from several parts of Saudi Arabia, but especially from the east. What he found that in some areas in the east, up to 25% have sickle cell trait, if they are from the Shia community. If they are Sunni, it's 10% of the times. From the other part of Saudi Arabia, they were much less. You will notice with the subsequent slides that this proportion appears to be close to what we know now. In other areas, not as accurate because of the number of people tested was quite small. This is a more recent study done by Dr. Al-Awami before he retired from King Faisal University. And they tested newborn from the cord blood, they took sample of the newborn and tested them from 3 hospitals, maternity hospital, Dammam, Al-Khubar, and Katif. And they tested a total of 5,630 newborn. This should be more representative because every newborn is tested. And this is what they found in the various areas. So sickle cell trait from maternity hospital in Dammam was 6.7, Al-Khubar 4.41, Katif it was almost 18%, for a total of 8.3% of the tested newborn. This is a more larger population from all over Saudi Arabia, done by Dr. Muhsin Al-Hazmi. He was in Riyadh University, or now King Saud University. And he tested a total of 30,055 people who were coming to the Ministry of Health clinics. These may not be representative of the whole population because people who go to the hospital are usually sick. But this is what we've got. In the Eastern Province, he found 21%. From the Central Province, very low. Northwest is not trivial, 7.5, and Southwest comes next to from the Eastern Province. In the North was very low, but the number was very small too. Oh, sorry, it was 3,530. So it was not trivial. This study was done over a period of 10 years and published in 1996. So how important public health problem is sickle cell disease? With migration, sickle cell disease is seen all over the world. In the United States, in South Africa, South America, and anywhere in the world you can find it. But its distribution is very variable, even in a close community. And Saudi Arabia, as I've shown you, the eastern province and southwest have the highest one, followed by the northwest. And the distribution follows historical malaria distribution. Seems people who are carrier for sickle cell disease have some protection, but that's another subject we leave there. What are the manifestations of sickle cell disease? Hemoglobin is what is in the red blood cells, and it is the hemoglobin that gives the blood its red color. The function of hemoglobin is to carry oxygen from the lungs to the rest of the body. There is a single change in the genetic code that give rise to this disease. So one change leads to one change in amino acid, and that is responsible for all changes from sickle cell disease. And it is a cascade of events at the end, is all the manifestation of sickle cell disease. This is the blood smear under the microscope after staining, and it shows both normal red cell, round, nice, and cells that have the shape of a sickle. This is where the name comes from. You would notice that not all red cells are sickle shape, only some of them. And that's what you see in the patient. Not all the cells in the body have the sickle shape. Okay, how does the manifestation of sickle cell occur, what we call sickling? This is first shown in this sketch or diagram, a comparison between on the left side, this side, normal red cell, round, nice, and they flow easily through the small blood vessels or capillaries, or small arterioles, small arteries. And this is a patient with sickle cell disease where some of the cells have sickle shape, and with the decreased oxygen that get worse, and they get stuck to the vessel wall and leading to its occlusion. So the blood vessel becomes inflamed, and the tissue supplied by it gets short in oxygen, causing its damage or at least injury. And this is worse when the oxygen is low, because when the oxygen gets low, the shape of the sickle cell change to this one. So this change in the red cell causes blockage of the blood vessel that decreases oxygen flow to the tissues, and that can cause pain in bones and joints, injury and damage to tissue because of lack of oxygen. And almost any organ in the body can be affected by this process. Also, this leads to shortening of the lifespan of the red cells, what we call breakdown and hemolysis, and that causes a decrease in hemoglobin or anemia. There is what the other name for sickle cell disease, sickle cell anemia, comes from. And this is chronic and ongoing. And sometimes the drop in hemoglobin is quite fast. So it can be chronic. Patients with sickle cell disease have low hemoglobin, but during crisis or episode of pain, or sometimes without pain, they can have a fast and drop in hemoglobin. The bone marrow, which is the blood factory, try to produce more red cells, but cannot fully compensate. So anemia is one of the manifestations of sickle cell disease. Of course, hemolysis, besides decreasing blood, results in other problems. This is not the time to discuss them now. So we have tissue damage. There is a shortage of oxygen to the tissue, and that leads to inflammation. And patients with sickle cell disease because some of the blockage is acute and large area, and that results in the pain, but other of it is ongoing slowly. That leads to chronic inflammation. And that's in its own right lead to adhesions of red blood cells, white blood cells, and platelets, which are the three blood components. And they adhere to the blood wall vessel, or the blood vessel walls. And this leads to both acute and sometimes slow chronic organ damage. And again, inflammation, when the body has always inflammation, as if somebody in a slow fire, and has its own harmful effect. What are the complications of sickle cell disease? It's very variable. What I'm going to mention are not inevitable. Some patients don't get these. The only thing that most patients have, the vast majority, is a decrease in their hemoglobin level or anemia. And this variability is not known why there is this variability, especially between individuals. So you have two patients with the same composition of blood. Some of them have a fairly severe disease and they are in hospital frequently and need help. Others not as badly affected. These variations are easier to explain when you take larger group of patients. For example, the percentage of hemoglobin S. Patients have variables. Some of them have above 95%. Some of them only have 70%. This is natural without intervention. For example, the local population in Eastern Saudi Arabia, the mean hemoglobin is probably about 77%. Compare that to more than 90% in most African variants. This is why the disease in Eastern Saudi Arabia is not as severe. I will not characterize this by mild, as mild, because many patients are severely affected. And some patients lead fairly good, useful, productive life without severe manifestation of the disease. Other variables, the presence of thalassemia trait. Thalassemia is defect in hemoglobin, makes the less production of the hemoglobin. And that interference is quite complicated, but that can also affect it either mostly positively, but sometimes not so positively. As I said earlier, and I want to emphasize this point, that despite all these difficulties and all the manifestation of the disease, many patients with sickle cell disease have a full and successful life. And there is no reason that the vast majority of patients with sickle cell disease can have that. This is just the diagram to show a big overview of possible complication, first in childhood from stroke, either with the obvious weakness or even silent, that just cause a decrease in the brain tissue and leading to neurocognitive impairment. The eyes are sometimes affected, not very common in our population. Even hearing, that many people don't recognize it, can be a manifestation of sickle cell disease because of occlusion of the blood supply to the inner ear. One of the major problems, more common than the other ones that I mentioned earlier, is acute chest syndrome, which is inflammation in the lungs, leading to decrease in oxygen. It can be mild, can be quite severe, requiring help with the breathing. The heart, because of chronic anemia, many times there's compensation, so the heart size, the pump, the left ventricle, which is the main pump of the heart, also have to compensate, so it's become bigger. The spleen is commonly enlarged initially and depends on the severity of the illness. Some patients it just shrinks gradually. to nothing. But in some patients, especially in our area, it's preserved for even in adulthood, it's still big. The liver can be affected. Gallstone are very common. And the kidneys can be also affected in rare cases. The bones are affected, and you hear many people sickle cell disease have damage to the head of the femur and even the shoulder that lead to pain and sometimes require changing it surgically. Boys and men can have priapism, which means prolonged painful erection that can lead to sexual dysfunction if it persists. In adults, we see the same sort of things that in children, but they are because of the ongoing problem. You could see retinopathy. It's not common here, I must say. Increase in the pressure on the lung. The heart sometimes gets affected, and there is failure of the heart. Chronic lung disease can occur. Liver can get dysfunctional. The kidneys can fail. This is rare, but it does occur. Splenic dysfunction is quite common, and some patients, as I said, have the shrunken, shriveled spleen, and some of them have large spleen. This is in our area. In the black population, spleen usually always shrink because of the severity of the disease. There are problems with pregnancy. Patients with sickle cell disease can have pregnancy, but they have at higher risk of complication during pregnancy. Leg ulcer is mainly in black people. I have not seen it here over the years. And priapism or painful erection and sexual dysfunction can occur if priapism persists for a long period of time. It does not resolve quickly. It can cause damage. How do you treat it? It is a treatment of sickle cell disease should have more than one aspect. One is to try to prevent the problem. And one of them is taking care of self and avoiding factors that may precipitate crises or episode of severe suffering, like pain or acute syndrome, these acute episodes. Not all of them can be, but if one takes care of self, it does decrease them, like making sure to drink adequate amount of fluid to avoid dehydration, avoid extreme temperature, whether heat or cold, and exertion. It doesn't mean that patients with sickle cell disease is just to stay and do nothing. That's harmful, but they need to know their limitation. Avoid infection, and this by vaccination. And beside the vaccination that all children and adults require, there are things that are more important to patients with sickle cell disease. And hand hygiene. Avoid stress as much as possible. This is probably easier said, we all know that, but stress can precipitate crisis. Smoking, alcohol are harmful to everybody, but especially patients who already have low oxygen, low hemoglobin, and low oxygen is more harmful to them. And keeping a regular checkup with their physicians and taking medication as prescribed. All of these measures should help to decrease the need to come to hospital, and hopefully will decrease the acute pain and other acute complications of sickle cell disease. Well, the patients need to know when to go to hospital, and these are a few of the important ones. Fever more than 38 degrees Celsius should not be ignored. Shortness of breath with or without chest pain should not be ignored. Severe fatigue that might indicate is decrease in hemoglobin, cause a breakdown of red cell acutely, and severe pain. Pain is nobody can measure it, only the patient who suffers from it can decide whether that pain is mild enough to be treated at home or the need for a hospital. Okay, medically, what can be done? Sometimes blood is excellent treatment for sickle cell disease, but it has many problems, so we don't give it lightly, have to think about it. But it's used to treat severe complications. For example, acute chest syndrome, one of the most common indication to give the patients blood, which is an acute problem in the lungs with inflammation and decrease in oxygen and pain. Stroke, to prevent it and to treat it acutely. Liver crises, not the most common, but if they occur, they require blood transfusion. And of course, if there is severe drop in hemoglobin, even if there are no other things. So blood transfusion can be used to treat acute episode and also to prevent recurrence, especially stroke. One of the most important drug, and for a long time, the only approved drug to treat sickle cell disease is hydroxyurea, also known as hydroxycarbamide. It was approved as a treatment of sickle cell disease by the FDA in 1998 in adults and 2017 for children. It comes in form of capsules that are taken once a day, regardless of the number. They can be all taken together. In multiple studies, it has been shown to decrease all complications of sickle cell disease, such as pain, crises, or episodes, admissions to hospital, need for blood transfusion, acute chest syndrome, stroke. In fact, for children who are at high risk to develop stroke, and that can be predicted by doing a special study to the speed of blood in the artery that feed the brain. It's been shown in good studies that prevent its development in children at risk. It also probably protects the kidneys, spleen, the brain, and the lungs. And multiple studies show that people who take hydroxyurea sickle cell disease prolongs their lives. How does hydroxyurea or hydroxycarbamide work? The patient feels the improvement in about 1 month, but the peak effect takes more than that, takes 3 months, maybe even longer in some patients. It has many ways by changing the composition of the blood that at the end result in decrease in the manifestation of sickle cell disease. For example, it decreases the percentage of hemoglobin S, which is the sickle hemoglobin, and increases the production of the fetal hemoglobin or hemoglobin F. And this not only decreases the proportion of S, but also hemoglobin F inhibits the sickling process in its own right. So it has two positive effects, decreasing the percentage of hemoglobin S and inhibiting sickling. It also decreases the usually high white cell and platelets. These are very common findings in patients with sickle cell disease. And they contribute to adhesion of red cells to the blood vessels, leading to precipitation of sickling process. It increases the size of the red cell and makes them more flexible. Usually it improves the hemoglobin. Probably has other effects that at the end, as I said, lead to its beneficial effect in patients with sickle cell disease. What are the side effects of hydroxyurea? Like any drugs, every drug has side effects. Side effects, by definition, occurs in a minority of patients. Sometimes small minority, some larger. It may lower blood cell count because it suppresses the bone marrow production. It may cause increase in skin pigment, especially with exposure to the sun, and that can be problematic to, especially to women. It may decrease fertility in males while using it. In fact, can decrease it that they have no sperm at all. And it should be stopped before pregnancy, but can be given after the first trimester or the first 12 weeks pregnancy. It's not a cure. It's a good treatment, but not a cure for sickle cell disease, so it has to be taken daily. It's not a painkiller. You don't take it when you have pain. It has to be taken regularly to prevent pain, not to treat it. It does not increase weight. This is the misconception in many patients. There are patients who gain weight because before hydroxyurea, they were sick out of the time. They are in hospital several times a year, sometimes a month. So they're sick, they cannot eat, they're malnourished. So that aspect, because they are healthier, they gain weight, not because hydroxyurea is an appetizer. And has positively changed the life of many, many, many patients. There are newer medication. These can be used alone, but usually added to hydroxyurea because the most effective, the most affordable. And these are less effective and more expensive. One is L-glutamine, which is amino acid. It used to be used as a dietary supplement. So it's a new use for an old medicine. Well, it's a diet really. It's taken in form powder, taken in a lot of it, grams. And its efficacy is not very high really, but it can help some patients either as an addition to hydroxyurea or those who don't or can't or don't tolerate hydroxyurea can use it. Another drug called crizanlizumab. It's a tongue twister, but that's its name. It's monoclonal antibodies. It's manufactured, it's a protein, and it decreases adhesion of blood cells to blood vessel wall. And if you recall, this is a major mechanism to precipitate crisis. It's given into the vein, usually 2 weeks in a row, then once every 4 weeks. The most recent addition is called voxelotor. Its effect on its tablet form, its effect on pain is quite small. So it's now marketed to increase or to improve hemoglobin level because pain, that's the approval, because effect on decreasing pain is not very high. Can we prevent sickle cell disease? Well, theoretically, yes. And that's by avoidance of incompatible marriages. What do I mean by that? I think most people in Saudi Arabia know that there is premarital testing, and one of the main component of it is to test if this marriage, if these two people who wants to get married will have children affected by sickle cell disease. So if these young people, or maybe not so young, but they can produce children, if each of them have a sickle cell gene or sickle cell trait, they will have, or at risk at least, to have children who are affected by sickle cell disease. Of course, as I said earlier, it's not only sickle cell disease. One of the couple may have sickle cell disease and the other may have beta thalassemia trait. The result is the same, or other hemoglobin that are not very prevalent in our area. Well, there are people who just want to get married in spite of the advice, or because before this premarital screening was available. So those who are at risk to have affected children should explore in vitro fertilization and pre-implantation genetic diagnosis, or PGD. This is easier said than done, of course, because it's difficult and expensive. There's the other option, antenatal diagnosis of affected fetus, and that can be for two purposes. One, to prepare for the arrival of a patient who is affected by sickle cell disease, or to terminate pregnancy. Of course, this proposition has religious, legal, and emotional difficulties and issues. So the best is the first choice, which is to avoid incompatible marriage. Is there a cure for sickle cell disease? Well, yes, not easy, but there is. It's by hematopoietic cell, or also known as bone marrow transplantation. This is the only potentially curative treatment currently. It's recommended for severely affected patients. For example, a child who suffered a stroke. What are the alternatives? One is to give a transfusion for the rest of that person's life every month. The other is to undergo hematopoietic cell transplantation. It's best done for a young person or patient, best below the age of 10, from a fully compatible sibling donor. So a brother or a sister who have the same tissue typing. Of course, now there are other options, and some of them are almost as good as fully compatible sibling. What are the complications? Risk of death during the procedure. It depends who you believe, and from various studies and the condition of the patient and the age. The younger, the better, and it range anywhere between 5 to 10%. And then there is the graft versus host disease. This is a chronic illness that the bone marrow that's being transplanted attack the patient. This is foreign. This is not me. This doesn't belong to me, so it attacks it and can affect multiple organs. Sterility because of preparation. High-dose chemotherapy is needed before bone transplantation, and the sterility is very high risk. And occasionally there is a rejection. They reject that, they will go to square one. That is, they will have sickle cell disease. Gene therapy is an active studies. It's actively studied, and there are many options, many approaches. Still considered experimental at this point. Hopefully in the future it may be a more viable option. The problem with these two also, how many in the world can afford these? These are expensive, although it's one-time deal, especially for hematopoietic cell transplantation. But they are not widely in many areas in which sickle cell disease is prevalent. It's available in Saudi Arabia in multiple centers, and especially the National Guard Hospital in Riyadh and King Faisal Specialist Hospital. So at the end, I'd like to summarize what we've been discussing, and that sickle cell disease, inherited disease, has major impact on the person living with it and their families, of course. But many affected people can live a full life. Its impact can be decreased by proper care. Medication, especially hydroxyurea, can improve and change the life of many affected patients. Hematopoietic cell transplantation can cure some of the patients. There is active research to improve and refine gene therapy. And just to remind everybody that sickle cell disease can be prevented. Thank you for your listening, and have a good day.